This video is to show how SystmOne practices in North West London can now access standardised prescribing sentences for medications that we often prescribe for patients with palliative care or end-of-life care needs, where they are having medications administered to them in their home by the community services. Why is this important? Well, if we use these prescribing sentences, it makes sure our prescriptions are really clear about the dosage instructions so that community services can accurately set up things like MAAR charts and ensure that medication is administered to patients correctly. So let's look at how this works. So if we click on an acute prescription, this should launch your North West London formulary, which is called Adults Integrated Formulary in SystmOne. Now, if you don't get this screen, I'll just give you a quick tip. If you click on the cog for the settings, and if you look at default formulary, there's a drop-down list, and that shows you a list of formularies that you can access. Now, currently, the North West London formulary is called the Adults Integrated Formulary. Now, obviously, this video could date, the name could change. You could check if you have any doubts, but make sure that is picked. And what I'd also say to you is, if you're making that change, make sure you shut down SystmOne correctly. That means just close the windows. Don't suddenly pull out your smart card. Don't just suddenly turn off your computer. That'll make sure your settings are saved so that every time you launch, it should launch into the North West London prescribing formulary. Right, so now let's click back into the formularies box. And if we search for a drug, I'm going to use cyclazine. And here you can see your options. The first one is the typical one we would get when we're prescribing for sort of any sort of patient. But now you can see two more options. You've got this one that says PRN. It's talking about the PRN dose. So this is when we're doing ad hoc or one-off doses to that patient's subcut. And you've also got a syringe pump option. That's when we're delivering a continuous dose through a infusion subcutaneously. So I'm just going to pick the syringe pump option. And if we double click on that, the most important thing is to complete the actual dose. So the dose is missing. It's got those X's to remind you. So if we type in a dose, I'm just going to say something like 100 milligrams or 2 mils. And make sure you check and adjust the quantity. It's got 5 ampules at the moment. And also the issue duration. If you can, maybe adjust it to make it more accurate. And when you've done it, click OK. So that is it. That just shows you that standardized prescribing sentence. But how else can you find them? If you go to auto consultation, and you may see things like care the elderly, you've got a care planning template. You can also access the care planning template through different options in auto consultation. But if we go back to the main search bar in SystmOne in the bottom left and we type in care planning, you can see the top option there, care planning template. If we click on that, this hopefully is familiar to you, and you might have seen that tab last phase of life. And previously towards the bottom, it started to talk about medications and anticipatory medications. Now there's a new tab that I've added next to it called MAAR's chart prescribing. So if you click on that, now this could evolve. So I'm showing you this, but think this video could date really rapidly. We may have changed approach. But what I've done initially is on the left, that's a list of the medications that have got prescribing sentences currently set up pan London. And in the first column on the right of the medication is the PRN options. And then the next column shows the syringe pump options. For some drugs, there may be different concentrations like morphine here. So it gives you the different options. But if we can look back at what I just did, so the cyclazine syringe pump, if you click on this link, it automatically loads that acute medication for that option in that North West London formulary. So this is another way to find those items in that formulary. I hope this is helpful. This is really important, like I said, to make sure we accurately communicate in our prescriptions the correct dosages and administration. So it helps our community services to correctly administer them and obviously keeps our patients safe. If you've got any suggestions, feedback, tweaks, please do let us know, and hopefully this will help things for you.